concludes the Whitley County adoption public hearing. We'll now close that portion and open up our regular council meeting. Sheriff Hodge, it's you first up.
Thank you.
You're a funny guy, aren't you?
I'm here to kind of bring you up to speed on a project that I've been working on for months. I think it's good news from the standpoint that I'm not asking for any money. The project is already funded for 2013, so we're good to go on that. I think I have shared with you over the months my need to investigate inmate health care and a company and a new contract. The contract that I have currently has been extended. It was supposed to end at the end of July. We have extended it for 3 months to try to get to the point of investigating companies to see who can give us the best product, not necessarily at the best price, but the best product, and I think we have done that. This process started in January. I thought within a few months we could have it taken care of. We're still working on it, but I think we're almost there. I have with me today representatives of Quality Correctional Care. Lisa Scroggins and Dr. Frank Krause are the owners and the operators of this company. They're going to provide you with their credentials and their background and what they believe is needed in this type of a business. Then I have my legal deputy, Attorney Howard Williams. I asked him to be here to really to impress upon you how important and how much liability there is in inmate health care and the number of lawsuits that's happened throughout the state and just the importance that we follow through on this the best that we can. So I think at this point I will ask Dr. Krause or Lisa, one or the other, to speak with you, and then we'll follow up with Howard.
Is that an option, either or? Good morning. Ladies and gentlemen.
Yeah.
Gentlemen.
Thank you.
Certainly. My name is Frank H. Krause, K-R-A-U-S-E. I feel like I'm on the witness stand this morning, so I always spell my name out when I'm on the witness stand. We really appreciate the opportunity to come and kind of fill you in what we've been doing for the past several months, working with the sheriff. And as far as a steward of your county's money, he's worked very hard and very diligent as far as looking at different companies, different options, different professional things that we bring to the table. Lisa will probably not tell you this, but she's she's our chief financial officer. As far as working with county councils and commissioners, she's worked for 3 different sheriffs and been a financial officer in Delaware County for 12, 15 years. So she knows how the system works. What happened in around about April of 2011 is I've been working, I admit this, I've been working in corrections for 40 years, and that's a long time. But we kind of looked at what was happening in some of the counties, and I never thought of myself as a vendor, but yesterday one of the commissioners called us vendors. I always thought I was like a professional, offering professional services, but I guess I truly am a vendor. So that kind of like calling a police officer a cop, I don't know what to do. But anyway, so as a potential vendor, we looked at some of the other health care providers for those that were incarcerated, and as far as the money that was costing our county and the professional services that were being provided, we just felt like we could put together a company and provide a lot better service at a lot lower cost. So that's what we've been doing. So since April of 2011, we now are in 10 counties. Hopefully with Whitley will be 11 counties. And what we're doing is we really like the idea of keeping tax dollars within the county and keeping things local. And what that means is if there are physicians available in the community, fine. If not, we have physicians that work with us, and we're really proud of the physicians we have. And it's different, as far as working in corrections other than working in like a family practice, because if you go to your family doctor and you want to walk away feeling good, it's not that way as working with inmates. And I'm sorry, we talk with an inmate and they're not sleeping, they have a sleep disorder, they have insomnia, or they have anxiety, or they're depressed. You just don't give them a medicine, give them a drug, and want them to feel better. They have to accept some of the consequences. The other thing, which again I think it's pretty self-explanatory in here, again, not everyone likes this idea, but part of what your responsibilities are is to provide mental health services to those that are incarcerated. And what's happening with the closure of the state hospitals in Indiana is the jails. Whitley County Jail has become the new asylum. And what that means is 65–70%, high percentage of those that are incarcerated not only have a substance abuse problem, but they also have a mental disease, mental disorder. So part of what we bring to the table is, again, not just treating the medical and the dental, but we're also doing the mental health. Again, not everyone likes to hear this, but, and Lisa knows the jail standards better than I ever will attempt to know, but we don't really have a choice. I mean, you have to provide a certain standard of care for the inmates. And part of going beyond that, what we also have to do is, when they leave your facility, when you leave the jail, a person is released, is to provide them with a discharge plan or a summary, or we think you need to do this, and to take some responsibility. I know that's kind of hard to digest, but that's just the way it is. So I taught at Ball State for 15 years, and I can stand up here and talk for 2 hours, but that would be a waste of everyone's time. So what I'd like to do is, if we'd say some things you'd like to add, or you have some questions, we'd be happy to answer the questions. We're excited about coming. Like I say, we're a small company. We don't plan on getting a whole lot larger. We like the idea of working locally, as I say, in your community. So, again, thanks for having us here. I kind of emphasize how hard your sheriff has worked to try to find what he feels is the best fit for your community. So, Lisa.
Well, I don't really need to add a whole lot to that. I would simply say we're delighted in the opportunity to be in Whitley County. We have a product that has a little different approach to inmate health care services that we're very proud of. We understand that overcrowding is a problem across the state and county jails, and the best way, in our opinion, to resolve that is to take a look at offering some treatments that maybe inmates are not getting in other facilities, and that means we treat things like addiction disorders and mental disorders, hopefully helping an inmate get on the right track so that maybe they won't reoffend and come back to your facility. That's what's best for our company, it's what's best for your community, it's what's best for your tax dollars. So that is kind of the premise of where our company began, and we are very proud of the services we offer and are delighted to have an opportunity to come into Whitley County, and we hope that you will be as satisfied with the services that we provide as our other sheriffs are. I think we are, as Dr. Cross said, we're in 10 counties. I believe that you could call any sheriff of those 10 counties and they would give us glowing reports. I spoke with a sheriff yesterday who says we're an A+. That makes me very happy. So we really don't want to be a huge, big company. We want to be a company that if you have a problem and you call Quality Correctional Care, you're going to get Dr. Krause or myself via our cell phones. We don't want to get to the point where it's a corporation that you're going to have to go through phone mail and so forth to get the results that you want. So we would love to answer any questions you have and look forward to an opportunity to begin. We're hoping to get the contract. The commissioners received it yesterday. We're hoping to get that executed at the October 15th meeting, and our goal at this point is to begin offering services November 1 in the county jail, should everything be approved and we stay on track as we are now.
Lisa, you made a statement yesterday that I really liked, and I had never thought about the inmates and the percentages of that return. So if you work on, do you recall what I'm talking about?
Yeah,
I think you just threw out a number, but I thought it was impressive.
It is. I mean, it's sad, is what it is. But
Yeah.
across the nation, there's about an 85% recidivism rate. You might have 2,000 inmates you book into your jail every year, but most of them are repeat offenders. You're going to have just a couple hundred new people every year, because you've got the same problems. They're addiction disorders, or and it's just a cycle. You rob a village pantry to get the money to buy the drugs, And then you have to rob another village pantry to get the money to buy the drugs, and it just keeps going on and on. So Dr. Krause and I, when we started putting together this company, you know, I had seen over the 15 years I was at Delaware County, just the same names over and over and over coming across my desk, and the fact that they are a drain on your community resources. You know, you're paying their medical, you're paying for their room and board. You know, they're not, when they're out, they're not contributing to your community by paying taxes or having decent jobs. So that's kind of our goal, is to help people find resolution to the problems in their lives. We will do that through a variety of means. One of the things that we do is if we can find someone services while they're in jail, if we can find, and Dr. Krause helped an inmate get his GED in one of our counties recently. Certainly not part of, you know, what any of the other companies would do, but something we're happy to do because it makes him more marketable when he's on the outside. So we try to find services. As he said, we'll give them a discharge plan. If someone starts a treatment while they're in jail, they start NA or AA or one of those kind of treatment plans, we'll give them an idea of where they can go for those same kinds of meetings when they're outside, hopefully perpetuating their healing process. So, you know, it's not we're not out to save the world. We know we can't save the world, but if we can help an inmate at a time, we believe that we're going to help the communities that we're serving as well.
And we're having fun too. We're enjoying it. Really positive.
Okay, is this a complete package, or is this an addition to what we have already?
This is a complete package,
Complete package, so.
replacing what you have already.
It's a
Yeah, it'll be a
replacement.
replacement to what, the company that we have now.
This is the entire package right here.
Yeah, Mr. Bear, what we're finding out as far as some of the vendors outside of the state, who actually Lisa brought the one vendor into our facility in Delaware County, and it was fine initially, but they've gotten larger and larger and larger, and all of a sudden, you know, we're sending our money to Illinois or Colorado or wherever it is, and so that's where we just, you know, and it kept getting more expensive every year. I mean, every year it was going up higher and higher and higher, and they charge like per diem for every inmate. I don't know how your facility is, but our facility, we're supposed to have 180 people, we have 330 people. And all of a sudden they're charging a per diem like $250 a day for each inmate. I mean, it's pretty expensive. And the fun part for us, again, as we're going and talking, and all of a sudden we're getting calls from counties saying, hey, we hear you're doing a good job. Would you come and talk to our sheriff, or talk to our matron, or talk to a county attorney or the council? Because it's really working out to save money. What Lisa's very modest about is what she does really, really well. And some people aren't aware of what you can do, but you know, some inmates, you know, they have insurance or they have Medicaid, and maybe that's a lapse. But again, Lisa's good about finding out if they have insurance, and why should a county have to pay a $57,000 hospital bill when, you know, the inmate has the facility, has the resources to do that. We were finding out that some counties were just paying dollar for dollar. As you know, you don't have to do that. Medicare plus 4%, you get away doing that. But she's been able to get that down lower, and I think the sheriff can tell one story for us that how she saved 25% of what the bill was. So that's what, as far as the profit, that's what Lisa, give her all the credit. That's what she does really, really well. In other words, if you get a doctor's bill or a hospital bill, you know, then that's what she negotiates it down. And that's where the savings comes. We just found other companies weren't doing it. Other companies were just going and paying out a flat fee, which is costing money out of all your pocket. So I can ramble for on and on.
Did you have?
Yeah, I have a question. How do you protect the county from liability when dealing with the inmates?
Well, we are obviously insured for medical malpractice, civil rights violations, general liability, workman's comp, and then automobile. We have 5 different insurance policies or coverages. We know from our experience that inmates have a lot of time on their hands to go to the law library in the jail and write lawsuits. And it is inevitable. It's not, will we ever get sued? It's when we get sued, will we be able to defend that lawsuit? We have policies and protocols in place. We will train all the correctional staff in the jail. We will take every step possible to make sure that we are providing a good service. You know, deliberate indifference is a phrase that makes my skin crawl to even think about the idea of that, because that's the phrase that inmates use, you know, they were indifferent to my medical needs. We don't ever want to be indifferent to anyone's medical needs. So first of all, we offer a good service. That's what's going to protect us. Secondly, inevitably, when we do get sued, we have the insurance coverage. Our insurance coverage is higher than state minimum requirements. Mr. Williams is going to address insurance probably with you in a little bit. You know, and we're willing to do whatever the county prefers that we do in that. But we are well insured from a standpoint of the state limits. We know that our responsibility when a lawsuit comes across is going to say Joe Smith is suing the commissioners, and he's suing the sheriff, and he's suing the county, and he's suing Quality Correctional Care, and then it'll list our doctors and nurses by name. And our priority is to make sure that the first names that get removed from those suits is Sheriff Hodges and the commissioners and Whitley County. We want to make sure that we're making the medical decisions, that your staff's not making medical decisions because they're not trained to make medical decisions, and that in itself will reduce your liability tremendously.
Thank you.
Good question.
Straight up dollars and cents from a council viewpoint, where are we at?
We're still looking at, we've got a base price, but we're still looking at different levels of insurance. And even if we take the highest level of insurance, the best coverage that we got, we're coming in under what we're currently paying.
So
Their
reduction.
charges will be less than what we are currently paying.
That's what we want to hear.
So all you care about is
Bottom
that's the fact.
Of all these services that you guys provided, is your charges on service-based, or is it population-based, or how is it figured?
It is an annual contract. You'll pay 1/12 of the annual contract each month, and it is not population-based. One of the things that we do that our nurses are going to be there, and during the course of a shift, whether they see 4 inmates or 20 inmates, it doesn't matter. Our nurses are there to do that. The doctors are the same way. So we do not charge a per diem if you go over a certain amount. We believe that the service is the service regardless. You know, you have X number of beds in your facility. Once they're full, they're full. You're going to start shipping people out at that point. So it is not service-based. It is strictly an annual contract.
Any other
Mr.
questions?
Mark, have you run this by any of the judges, or either one of the judges, or I'm just,
No, I didn't see the need to do that.
Any other questions for these two individuals?
Our phone numbers are in the brochure, and if you do think of some questions, or maybe as an afterthought, feel free to give us a call and try to respond to questions. Appreciate your time.
Thank you. Howard Williams, do you have additional?
Yeah, just